Okay, so the models that I will be distributing are at this link here. And if you go to that link, tinyurl.com/UMass GSS modeling with 1L 2017 models. If you go to that link here, what you will find is something that looks like okay, I guess most of us are on the slow connection, so it's taking its pretty time. There's going to be a list of models here. These are what are called ALP files. That stands for Any Logic Project files. And if you want to download them through here, there's just a tiny bit of finesse here that's required, depending on the browser. These are files. If you go and double click on one of those, it will open, and don't be afraid by that. Up in the upper right is a download button, and you can just download it to your machine. And once it's on your machine, and you're presumably in your downloads file folder, you can go open it in AnyLogic, okay? And you do file open and go grab that model, okay? Again, we won't be doing that immediately with AnyLogic, but we will do it here in maybe 15 or 20 minutes, okay? So in anticipation of that, I think I will fire up my AnyLogic here. I don't see it running anywhere, so I will fire it up and get it going, okay? So I'm going to go fire up the same version that you are, version 8.10, and we'll just let that load. Okay, so ladies and gentlemen, system dynamics in health. This is an area in which I've been working for almost 20 years now, having applied system dynamics more broadly in a variety of areas over the course of the past 25 plus years. System dynamics is an area of modeling that's quite unique in its blend of qualitative and quantitative components, quite unique in its focus on engagements with stakeholders and the value and potential of the modeling process, and quite unique in terms of its ability to characterize feedback-based systems which particularly have regulatory feedbacks where the system is in some sense partially or wholly self-regulating, in the sense that it has internal dynamics in terms of continuous variables, continuous quantities, my level of blood glucose and insulin, or at a broader level, the number of individuals who are afflicted with prediabetes or diabetes in the population, and understanding how those change over time. As with all these sessions, the key question is, as my colleague Jeff McDonnell in Sydney puts it, what's the 90% I'm going to leave out? I'm going to try to navigate you through a brief introduction to system dynamics that provides an opportunity for hands-on experience with this technique, because it is also distinguished by use of models that anyone from any background can understand. It doesn't require programming in a traditional sense of the word. It doesn't require that you have some nerd behind a curtain, working over some complicated code. It's something that's widely accessible, and that's one of its strengths, and it's one of its strengths in a team context particularly. So we're going to get you working with it, but recognize that I'm just hitting the top level, and there's resources I can refer you to go much deeper. Okay. Our focus today will be on both the qualitative and the quantitative side of system dynamics, but we won't tap anything. We'll be particularly shallow in our touching on some of the analytic components of system dynamics, because most people in the room don't have a background in differential equations or perhaps integral calculus, and most system dynamics modelers also don't don't have familiarity with that. But for those who do, there's tremendous depth there. So what is system dynamics? I mentioned it earlier, and I'm going to go light on these sections. But I want to hit, you've heard an awful lot over the past few days, and I want to hit on some broad features so that you'll bring them back into working memory. System dynamics is a modeling approach, and yes, it includes a quantitative modeling approach that focuses on the phenomena of feedback. Feedback is a situation where a change in a system ripples around and pushes back against or amplifies that original change. And it may sound like a curiosity, but it turns out it is fundamental for shaping the dynamics of systems over time. A system without feedback and a system with feedback behave in wildly different ways. And by understanding the feedbacks, often we can better understand where behavior is coming from and how to improve our ability to govern that behavior. So whether it's behavior of a healthcare system, our ability to serve patients in an emergency department in a very timely fashion, whether it's helping to stem the rise of chronic diseases, whether it's helping to head off the gnarly tangling of gestational and type 2 diabetes, or the spread of infection in a population, or indeed to keep our policies effective in the health context. System dynamics focuses on feedbacks because often they're where the action's at for really having the greatest leverage in the system. Far from being an intellectual curiosity alone, it's a point of leverage. It's a point of making a difference. But system dynamics is also sort of distinguished by a broad evolving methodology that helps us conceptualize these systems. It focuses a lot on our mental models of these systems, describe the systems in a transparent way that people from any background, any walk of life, people who have had no university education can relate to and understand, and more than that, contribute to. It's important in a stakeholder context to secure buy-in, but it's also important to elicit the mental models, at least the perceptions, and maybe the knowledge that people from the highest ranks of society to the lowest can bring to bear to a project. And its means systems allow us to do that. But it also provides tools that, for more technically inclined individuals, can help us rigorously analyze a system and better manage it. Okay? So system dynamics is a broad methodology. It's one that has been around since the late 1950s. And okay, here's any logic. Late 1950s, and continues to be to evolve in terms of some of the details. Why do I use system dynamics? Why do I apply system dynamics? I've been applying agent-based modeling for 27 years now, longer than system dynamics. I'm the uber geek behind the curtain a lot of the time, and I value my hands-on work. I do software engineering. I was doing it about 11 p.m. last night to help a student back in our lab. Why do I do system dynamics? Why do I do this stuff that doesn't require programming, etc.? Well, because it's super powerful. And it's powerful in the human theater as well as in the sort of details. The qualitative, quantitative components have this nice balance between them and our ability to elicit understanding and perceptions from everyone and hearing voices that otherwise wouldn't be heard. And yet quantitative components that can add a lot of rigor. We can create, and Kurt can attest to this, very rough and ready models. We can create models in system dynamics extremely quickly. Anyone in this room could do it. If we were to spend a day on the quantitative side, you could quite quickly create a model compared to the time it takes to create it over in an agent-based context. And it allows us to sort of iterate quickly and even learn from that model in a very rapid fashion. It provides a language, both in the qualitative side, the causal diagram, but also, as Kurt will show, on the quantitative side, for representing factors that are squishy, that are hard to quantify. We don't know exactly how much impact they have often, but we know they're really important. And we can't just leave them out, because we'll be assigning them, as it were, the one value we're confident they don't have, 0 impact. So it provides us a way of sort of characterizing these squishy factors in a quite sort of succinct and crisp way. It provides, moreover, a very well studied, well supported, well documented, well refined, iterative modeling process that delivers value from the very first day with a stakeholder. It's not a matter of saying we're going to build a great model, we're going to build a really rich model, and 6 months from now, a year from now, we'll be back with you and have you interact with this model. It's about actually bringing people in and helping them feel vested, engaged with, a sense of ownership with, and a sense of buy-in into a process from the very first few hours you're engaging with them. As time techniques for working with diverse interdisciplinary stakeholders, for using models not as something that's producing estimates you've got to convince people that are well grounded, but as something they've contributed to. But the model is actually used as what we call a boundary object. It's used as a common point of understanding from people who speak very different languages. Think clinician, think a homeless person who's involved in the discussions of challenges of health amongst homeless in the city. Think a professor of computer science. Think a medical health officer from the local health region. These are people who are speaking quite different languages, and the model provides this sort of common point of discussion where they can point to something and everyone will have confidence that they're basically referring to the same part of the system without fancy words that might throw off people. It can help lower the power differentials as well. The tools are highly accessible to health scientists. Every year, health scientists come to me seeking to learn the requisite skills to not only design models in the agent-based space, in hybrid space, but also to implement them, to be able to take the steps to put them into practice. And there's quite a bit of education that's needed to go from model design, which I think is very readily attainable with the right tools, to model implementation, because there's this, in agent-based context, there's a thing called the programming language you have to become familiar with. And system dynamics provides a declarative mechanism of describing a model. It focuses on the what. What are you describing? And it takes care of basically the how. Okay, it takes care of the how. So there's not a programming barrier there in a traditional sense. Side note, I'm developing a similar language for agent-based model. We've done a lot towards it, and there's a lot of potential to allow it to focus on the what and not the how. Suffice it to say, I'm utterly embarrassed as a computer scientist at the state of the field for agent-based programming. It's just shameful. It also provides this rigorous mathematical foundation we won't go into. It supports rich theory-driven modeling. There's enormous literatures out there that characterize systems in the terms that can be translated on a one-to-one basis into system dynamics models, even though they may not phrase their model in the language or in this sort of using the term system dynamics. It goes right into there. We heard one from Matt the other day, just yesterday, in fact, the model from Roger Hall of metabolism and body composition and body weight change. That is phrased in a mathematical format that is basically directly translatable into a system dynamics model. And indeed, much of our work takes models from the literature that are well described. You'll even see some of them today, and puts it into context where we use it in system dynamics tools, which are accessible to stakeholders. There's a rich set of analysis tools that's been built up over the years. I've helped contribute to that. And it has a real easy way of interfacing very nicely with computational statistics and machine learning. So one thing I love about system dynamics is the ease of linking up with social media feeds or search data over time. We can drive a model using tools like particle filtering that basically has a rough and ready model, and as new data comes in, we learn from that data, and the model becomes more and more able to capture the underlying dynamics and allows us to estimate the underlying state in a way that would be, at this point, quite infeasible with agent-based modeling, although down the road, we're working on it. Okay, system dynamics.
Just a clarification.
Yes.
So both in terms of the group model development
Yep.
and also what you just said about different types of big data,
Yep.
it sounds like it's not that agent-based modeling is intrinsically unable to do these things.
No.
It's that there hasn't been a well-developed technology around it.
Correct.
So, okay.
Well-developed technology, well-developed process. There hasn't been the commitment to make it happen sometimes, but there's some technical finesse, particularly in the machine learning side, that Kurt or I could talk with you about, having to do with the dimensionality of the space, et cetera. But we're working on it very intensively, and I believe that 20 years from now, agent-based modeling and system dynamics, if done right, we should be able to greatly equalize the advantages that system dynamics has in those areas with agent-based modeling.
Well, I'm asking mainly because I know people are going to have to choose a method.
Yep.
And I'm talking to some people, it seems like part of the appeal of system dynamics, for example, is the group model development. But it sounds like that could be done with ABM as well, but there isn't a methodology around it.
There is, that we have,
Okay.
but
there
it's
is a new method, newer method.
Yeah, and we've published on it together with Peter Hoffman, in fact Ross. We published on adaptation of group model building processes for agent-based modeling. But we've come a long way since that paper, which was 4 or 5 years ago. And we actually do have a modeling language, visual modeling language that we believe responsive to group model building for agent-based and hybrid models.
Okay, so that's actually not a good reason to select system dynamics as a methodology over. I'm just trying to clarify as people think about their selection justification, whether or not that is the right motivation for choosing.
I think it still is the right motivation because our language is still a research language. It has some distance to go. And maybe more to the point, out there in the system dynamics literature, these are great questions. Out there in the system dynamics literature, there's an extensive body of work and resources like the so-called Scriptopedia that Peter Hoffman maintains. You can go Google it, Scriptopedia. It has these scripts for group model building, for system dynamics models, et cetera, and it's all codified and so on. And we don't have anything, we don't have a pale cipher compared to that. What we are doing is building a language that we believe will be as responsive as causal loop diagramming and stock and flow language for sort of sketching out what might be in a model and sort of thinking through how things are connected. So it captures geographic context and network context and nested contexts, et cetera. And we have software to support it. But we have a long way to go on the process side and actually trying it out and seeing how responsive it is and refining it. System dynamics is, has been at it for decades, and we have some distance to go. But within the next 5 years, looking forward, I think we'll be dealing with a situation where that disappears as an absolutely overwhelming, gain for system dynamics. But as we'll see, it shapes the formalisms in big ways. So I made the remark earlier, and I think it's a fundamental one, that when we think about system dynamics and kind of in the context of multiple modeling methodologies, it's extremely easy to focus on the minutiae. It's easy to focus on, you're using stocks to represent sort of the state of the system rather than properties of of individual agents or whatever, and that's great. Being clear about those distinctions is good, but don't be caught up in them as the defining differences. It's not merely matter that this one uses a Cyrillic alphabet and this one uses a Latin alphabet. It's not merely something like that. There's actually a fundamental difference in the problems that typically we're trying to solve with system dynamics, and a difference that follows from that in the methodologies that we need that we use in the process that we use. It's often in the framing of the problem and sort of our choice of what is viewed as a problem and the goal of the model. We'll come to this a little bit more in just a few minutes, okay? So I noted the other day that a central focus of system dynamics, if I had to pick out one thing that distinguishes system dynamics, when I go and I talk with people from agent-based modeling community or discrete event modeling community or what have you, what really stands out, the one thing more than anything else, is that system dynamics focuses on changing how people think about systems. They're not satisfied with giving you the right answer to some policy problem. They're not satisfied with giving you some projection or some trade-off between policy portfolios so you can choose the best one. That's often of interest, but the foremost thing is they're interested in changing how stakeholders think about a system, because they want to help those stakeholders better manage that system, better be able to change the course of public health for the better in the health context. Okay, and the thought here is that, and this goes back decades, Josh Epstein, I think, picked up on it, this terminology that has been used for decades in system dynamics about mental models. This idea that, look, we're making decisions based on something, and often it's kind of inchoate, imprecise, incompletely reasoned about, it's opaque to others because it's in our head, our understanding about a situation. And sometimes we have cognitive dissonance, and sometimes we think one thing, and sometimes we think another. And in this context, system dynamics views the use of models as, in large part, a way of taking that mental model out, sharing it, and allowing many to gain from it, refine it, contribute to it, and ultimately to change how they think about their place in the system and their relationship with other stakeholders. So common questions in system dynamics. How do we most effectively improve stakeholders, the clarity of stakeholders' mental models? How can we catalyze higher stakeholder cooperation? This is a big goal of a lot of modeling projects in system dynamics. You may think of modeling as, a better way to get a good answer, a more reliable, robust, quick answer. You may think of it as a learning opportunity, and that very much comes out of the system dynamics area. But a lot of models in system dynamics are designed to stimulate cooperation between groups that otherwise work at loggerheads. Some of my earliest work in system dynamics, 1993, 94. Kurt was not my grad student at the time.
I was applying back then.
What's that?
I was applying for it back then.
Yeah. We were doing work for organizations. It was for state educational systems within the U.S. We had a modeling framework. We were basically going around the U.S. and using to help inform decision making when it came to university decision making, administrative decision making, and we were dealing with a state system that was constantly at loggerheads with the funding for a secondary K through 12 education. They were competing for certain pots of education money. Higher ed was butting heads with K through 12 for the state budget, and they were constantly going back and forth about what the division should be, not wanting their own turf to be underfunded. And the model we worked with them for totally changed that situation, in the sense that they came to realize that actually by butting heads with K through 12, they were shortchanging themselves. Because ultimately the higher ed system depends on the success of the K through 12 system. And it literally changed the way in which they approached their relationship with the funding context, so that they instead joined forces with K through 12 to put on a united front to argue for the need for funding for education as a whole, and to think of it as a coordinated whole, not as a set of fragmented pieces that you could pick and choose what to fund. That's not the way the system works any more than King Canute's advisors understood how the tide works. You got to deal with it as a whole, because there are flows between the parts of the system, which means it has to be in some sense in balance. And they found that they could save money by doing that, because amongst other things, they were engaged in so much remedial education to accommodate for the deficiencies and the things that couldn't be covered in K through 12, et cetera. The emphasis there is very much on the learning front. We're going to talk within this morning's session and have some experience with components of the system dynamics modeling process. And I put it out here, and I want to emphasize a few things. First of all, the delivery, from the standpoint of system dynamics, the foremost deliverable is the mental model. Mental model of stakeholders. Not of the modeler so much as the stakeholders, although proving the mental model of the modeler is also very important as a means of communicating. Secondly, it's a multi-stage process. We're going to only deal today with really the first three components here. Thirdly, it's an iterative process. You'll notice the reverse arrows. It has a staged, sort of staggered, phased form to it. It has regularities and ordering to it. And it goes from very qualitative to quite quantitative. But woven all throughout it, many, many pieces here, really each step, stakeholder feedback, stakeholder involvement, stakeholder engagement, stakeholder voices. So we're going to be talking about the first three elements here, and I'm going to spend more time on the problem mapping and model formulation side. Problem mapping, we're going to talk quite a bit about causal loop diagrams. Model formulation, stock and flow diagrams, and quantitative models. So the view that I articulated earlier on models are thinking prostheses, thinking tools to help us think more deeply, robustly, reliably, quickly through problems. Tools that help us make sense of empirical data, empirical evidence, in a more reliable way than if we were just relying on mental models. It's very much a sort of ideas that are consistent with system dynamics, if not ubiquitous within it. And mental models in this context are used in many of the same ways that agent-based models, but the balance is different. There's more emphasis on communication on an ongoing basis, helping stakeholders within that system to kind of understand their place in the system and how it relates to the place of others. Because, ladies and gentlemen, so often when we're in complex systems, health system, the healthcare system, we work within it as if it's a fragmented, siloed sort of context where, we have the mental health folks over there, and we have the folks who deal with developmental difficulties here, and we have social workers over there, and we have public health people over here. And they're not dealing with the issues in a coherent way, even though the people have all these components, all these needs tied up with them. We often deal with them as solitudes, and system dynamics focuses on trying to link those up. So the evolution here is of the mental model in conjunction with modeling artifacts that are runnable, that shape our mental model And hopefully we can put some of those things into effect, observe the results, and learn from it. Now, system dynamics has long recognized that, look, we build up models, and very often in system dynamics, we build up quantitative models that can be run and delivered to the client who understands what's in them, the assumptions, can run them, etc., for many successful situations. And it's widely regarded that even if that model were, through to some computational catastrophe, be lost, someone deletes it, it's lost due to malware, the computer is crushed. Often the greatest value has been delivered through the modeling process. Now that sounds outlandish. After all this effort being put in to develop a quantitative model, how can it be the modeling process develops the biggest assets? Well, because in system dynamics, modeling process is not something that is valued as much behind the curtain as in the milieu of a team, of a broad team, and in the milieu of a large commitment across an interdisciplinary group to building this model, to informing it, etc. And that process requires people to reflect on their mental models very much. It requires them to reflect on what they know, what they don't know about their system. It requires them to bring out in discussion with each other how they see how the system works. Remember one modeling project where we were talking about a large manual that codified exactly how it was a hospital type system, exactly how the system worked. It was all documented. And as a modeler, I thought, wow, this is great. We have this exhaustive sort of categorization. But as is often the case, you talk with the people who are in the trenches. Forget about that. Forget about that. That's the theory. The reality is, amongst other things, that internal medicine beds. Are you kidding? You think the people in internal medicine, needing internal medicine care and being delivered internal medicine services in the hospital, you think they're in the internal medicine wards alone? No, they're in the mat wards as well. They're over there in surgery wards. Not in the pediatric wards. They're not in mental health, but they're in a bunch of other wards as well. So in theory, we put the patients of certain sorts in certain places. The reality is things are different. Human adaptation goes on in ways that are not fully codified within the evidence. And often a modeling project brings this out. It brings out, oh, you mean that's how you're doing things these days? Back when I was doing it, we used to do it this way. And it brings out a lot of understanding about what's currently going on that's then put into the model. It forces a reflection of what is known and what's not known, where the evidence gaps are. It forces you to do environmental scans. It forces you to do literature searches, etc. And you come out of there with a sharpened perspective about where we're at and where we could be. And a good model will then be the icing on the cake. It'll be the thing that allows that team to continue to learn more effectively. But even if that model were lost through some tragedy, often the team is catalyzed in a way by that modeling process that is, if not transformative, at least significant. They learn what parts each other plays within the system, because too often we see people working in other areas of the system as in just sort of inchoate ways. This is notion of outgroup homogeneity. I just gave a talk last week for a computational model, and we kind of see them as we're not really quite clear what they do, and they're kind of variants of each other, and then by meeting up in a modeling process, we learn what they do in more details. Now, we don't want to lose the model, though. We don't want to have the computer crushed and lose the modeling artifact. Often the model plays a really important role here, and Kurt can testify to this from some of his earliest work in our group, spent embedded working for a Ministry of Health project, and in one of these interdisciplinary teams with people looking over his shoulder and informing what goes into the model. Models can serve as these boundary objects, these objects that multiple parties contribute to. And what is key here, what needs to be clear, is that the model needs to be understandable by members of this team. If this is a bunch of Java code, that's not going to be very helpful for eliciting feedback. They're not going to be able to look at it and say, oh, wait, you're missing something here. Or, wait, you really need to treat this thing you're treating as one thing, active TB, and divide it into infectious and uninfectious active TB, because it's key for understanding this. They're not going to be able to scrutinize the assumptions and push you to refine them. So system dynamics models, as we'll see, are designed to do that. They're designed to be transparent enough that people can contribute to. But it turns out the model it's more than it lowers the barriers to this communication. It often becomes kind of the common point of discussion among a team from very different backgrounds. It's kind of the hub, the focal point. And I will say the modeling approach and the software used has a major impact on our ability to perform that. System dynamics has long sought its models to serve as effective boundary objects, really since the late 70s and 1980s, in which time there was kind of a civil war in system dynamics between the kind of uber technical people who said, look, system dynamics modeling is hard stuff. It's technically demanding. You need technical excellence. At the time, you need a PhD from MIT. MIT is kind of the hub of the system dynamics world. You need a PhD from MIT, trained in system dynamics to do it well. And we don't want people coming to system dynamics models who have no business dealing with them, because they'll end up doing things which harm themselves. Just like you don't want someone to come in and use a power tool who has no exposure to it. You don't want them to be able to get on the dozer and start using a front-end loader for fun, and they'll end up in a bad way. So the idea was it's powerful, it's deep, it's demanding, it is analytically tricky, and you need trained operators to do it, just like for a flying plane. And then there was the other camp who said, wait a minute. The knowledge about our systems are distributed not only in PhDs from MIT, I can vouch for that. They're distributed among large numbers of other people and large numbers of stakeholders, and by building a model in a way that's understandable, we can tap into a much greater level of knowledge. And long story short, the latter camp won, although you'll still find some folks who secretly nurse sort of aspirations of keeping it very, very tight to their chest. And that led to a transformation in how we represent models from code, computer code, to something that is eminently understandable. The key guy there was Barry Richmond, who pioneered with the Mac the use of visual tools for system dynamics, stock and flow diagrams, and the rest is history. Sadly, Barry passed away maybe 20 years ago now, and left us a legacy of reconceptualization. So system dynamics models come in two big forms: causal loop diagrams, which we'll be jumping into in just a moment, and stock and flow diagrams. Stock and flow diagrams are potentially runnable. They can be used to diagram out, map out a system, but if we're building a quantitative system dynamic model, we're doing it with stock and flow diagrams. Causal loop diagrams you can't run, but they can be very useful for capturing people's understandings, perception of the system, etc. System dynamics is a broad field. It's, in my view, broader than even agent-based modeling. I take that, actually, I take that back. I don't want to go out on a limb and say that. So, agent-based modeling has breadth, particularly if you consider, as I do, the boundary with microsimulation model and debatable, etc. I I think we'll come back to this tomorrow when we talk about participatory approaches. But suffice it to say, within system dynamics, you will find people who have very different goals and who have very different perspectives. And the two that are articulated here, this from Peter Hoffman, who adapted it from David Lane, both of them extraordinarily thoughtful system dynamicists and accomplished practitioners. And it highlights the fact that some system dynamics models are undertaken with more of a goal towards sort of tweaking a system and involving and regulating it in a quantitative way, and others aspire to radical change, totally rethinking how we do things. At the same time, there are some models and some projects that focus on, well, more objective views of the situation. How do we figure out the right policy, the policy that will yield the greatest gain in terms of cost effectiveness? I did some of my earliest health modeling work with system dynamics models for cost effectiveness, and I still play quite a bit in that space with both agent-based and system dynamics models. This involves more of an objective, sort of quantitative outcome that we're hoping to be able to identify some concrete point of hard learning from it. By contrast, many system dynamics models are focused on helping people coordinate more effectively, helping people to learn more effectively. And I have to say, I play more on the right-hand side of this space than the left-hand side. Peter Hoffman plays more on the left-hand side. And lots of other system dynamicists are spread across the spectrum. Call it my recovery still from an engineering education. I remember hearing from a fellow, someone I enormously admire, a fellow modeler, does both SD and ABM with virtuosity, Jeff McDonnell. I heard him, he told me one time, and I have to say that my heart rebelled against it, but I came to terms with it after a long time, and I think he's right. I think he's completely right. He says he views modeling as storytelling in many cases. It's linked in with the need to tell a compelling story in a policy context to build useful models that really get used to their greatest potential. That's not to say it's limited to storytelling by any means, but there's a role of simulation modeling and storytelling is what I'm saying. That's all I'm saying here. And much of what we do on the left-hand side here is sort of simulation modeling for storytelling. We use simulation modeling, grounded simulation modeling, to help us better understand and develop a narrative that helps motivate people to coordinate more effectively, or helps shape heuristics and kind of ways of thinking about a system that shape how people learn from a system so they can learn from it more effectively. I remember Jeff McDonnell in a meeting with a set of clinicians, and basically taking them to task for certain traditional ways of quantifying health service delivery, and basically saying, look, that's not the right way to think about a system. It's like think about a heart. When you're asking how good is heart health, asking what's the fraction of the heart that's filled with blood. He was saying that capacity, sort of measuring capacity, fraction of capacity used is like that in health. And really you should think about it in a dynamic sense of, how effective is the heart at pumping blood. And he would use these very effective analogies, very effective stories to get them to reorient their thinking about this. And models can be very effective at doing that because models, and I think actually even more so with agent-based models, can tell stories. There's narratives as part of it. There's trajectories of people. You can point to a person and ask about their history, their encounters over time. And that can be very powerful for translating ideas into the context of someone who has no modeling experience and background. So, while initially resistant to it, I have come to peace with that role of modeling, even though I don't put my foremost efforts into being a storyteller. Okay, we're going to come back to participatory discourse, how how it takes place, the various forms that it uses, from stock and flow models to causal loop diagrams, the ways in which we can use it even in a hybrid modeling context. We'll talk about that tomorrow, okay? A little bit more detail. Let's talk about problem conceptualization. I noted early on that models are like maps, they're always incomplete, and model scope is a particularly key one we focus on. I think I'm also going to leave some comments on best practices for model conceptualization for tomorrow as well, but we'll return to this. Suffice it to say, it's very interesting when with respect to model scope. Often in system dynamics, when we first conceptualize a causal loop diagram, it's a qualitative, what I would call semi-qualitative method. It actually incorporates polarities and directionality. It allows you to reason about positive and negative feedbacks, but it's not quantitative in the sense that it's precise enough to simulate. But at a causal loop diagramming stage, often we're more fulsome and thinking about what factors are relevant to a model, and then we carve off pieces of it and build a more narrow system dynamics model. It's an interesting observation that in system dynamics, model building, quantitative model building, we are more constrained in our language. We are using fewer building blocks than we do in agent-based modeling. One time Kurt was working on a project. In fact, the project for Ministry of Health. He'd been working with system dynamics models for 3 months at the time, and got a tremendous amount of insight from it. They were hubs for stakeholder reflection and comment, etc. These system dynamics models, and they contribute a lot, and they sharpened our thinking about the situation. But there were certain things, and they help understand where to intervene in the system, but there were certain things about representing particular interventions, among other things, that were hard to express in the system dynamics model. So Kurt sought my counsel on this. And I told him, okay, why don't you take a week? He's that good. Take a week and try this in an individual-based modeling context. Just try putting down a representation of much of what you've captured in individual-based concepts, fit it on for size, see what the difficulties will be, get a sense of what the other challenges were. And he told me the next week, he said he felt like he had been walking in a maze of little corridors, trying to figure out how to represent some of these things, trying to force fit them into an aggregate system dynamics model. And now he felt like he was running across a field in the wide open. You know, we are from Saskatchewan, so running across a prairie, and so on. And that's both an opportunity. He felt freed, liberated. His youthful vigor was refreshed.
Any comments, Chris?
He's doing a really good job.
But at the same time, it's one of the biggest dangers of agent-based models because it's extremely easy, particularly for beginners, to just say, oh, we can add that in, we can add this in, we can put that, we can represent this as well, and just start loading things up. And believe me, the number of projects that have failed through that is very large. You get them all, you don't know what's going on, you run it, you see weird things happening, you don't know if they're bugs, you don't know what they're coming from, you're not sure what to learn from it. You know, it's you got to be particularly careful with agent-based modeling because adding things in is particularly easy for someone with the requisite training. In system dynamics modeling, the actual mechanisms we use for quantitative models require more explicit thinking, how to represent something, and it pushes back at you in terms of complexity. It becomes harder to add things, and so we end up spending more time on it. Is that fair to say, Kurt? Yeah. Okay. System dynamics, you will find, I'm going to dive into it now, and you'll see my examples are from a wide variety of levels of aggregation. People in health, particularly people who do not contribute to system dynamics in health, but actually, I won't say particularly, no, there's a lot of system dynamics people, in health who also think this way think of system dynamics' role as being quite specifically in health the use of aggregate population level models. By aggregate, I mean a stock represents a count of people who have a certain state or characteristic. And we'll see that quite a bit. I personally think that that there's equally or even more to gain. We use these a lot. We use them with machine learning tools like particle filtering. They're great stuff. But there's, and I've done a lot of that, and I think highly of much work in that area, often for building a model quite quickly. But often we end up building models in system dynamics that are at the level of an individual, or within an individual we characterize things in a system dynamics way. Because within our bodies, there's all sorts of regulatory processes, all sorts of feedbacks. And we'll model, our body's response to infection with this, or model the glucose regulatory system, or the decline in beta cells with, in the context of growing insulin resistance, et cetera, using a system dynamics model. And this is really rich and powerful, and system dynamics has a huge amount to contribute in that area. Okay, I'm going to come back to that. Okay, so I'd like to jump in to qualitative problem mapping with system dynamics, okay? So this is sort of the second stage. We're talking more about problem conceptualization last time. Okay, so when we're thinking about characterizing a system within system dynamics, we make use of diagrams that bring out feedbacks. And we'll probably come back to this slide. But I noted earlier in the opening comments that feedbacks are chosen not just because they're intellectually intriguing, they are, but because they have a profound impact on the dynamics of a system. Profound in that it completely qualitatively changes, the presence of a feedback can typically totally change the dynamic scene within a system. Change it from being something that's out of balance to something that's in balance, lead to very rapid growth in terms of the number of people infected or the level of viral load within your body or what have you. And, if you think about our context day to day, we depend on regulatory systems, often subcognitive, below the level of conscious awareness, to navigate us through the day. We have our systems to keep us in balance, right? We have our systems which make sure we stay hydrated. We get thirsty, we take a drink. We get hungry, we eat. We get tired, we sleep, etc. Think about how you got here this morning. Driving in will be absolutely hopeless. Walking in will be absolutely hopeless without feedback. Look where you are and you adjust your mental model. Important sort of forward link to something tomorrow. And even at a biological level or taxonomic level, we divide things between hot-blooded animals and cold-blooded, things which regulate their internal heat and those that don't. And we focus, introducing a feedback can fundamentally alter a system's behavior. When I teach my course back home, one of the sort of props I like to use, and I was trying to find something this morning, but I didn't want to come in with a weirdly shapen stick, was something I could balance on my finger. I asked my students to balance a yardstick, up in Canada it's a meter stick, on their finger. All right, have you ever done that? Or a broomstick? Right? It's a lot of fun, right? And what do you depend on to keep that fully vertical? What do you depend on? Let me ask you this. Could you do it just as effectively closing your eyes? No, you depend on the feedback, right? You depend on noticing where it's tilting and getting your finger under it, right? Some people can do this for minutes, hours. And if you tried it without looking, you'd end up, you might hit your head, right? With a big bruise. Feedback completely alters the stability of systems, their ability to function, their ability to sort of self-regulate and and manage themselves. And much of system dynamics is focused on this notion of representing feedbacks, thinking about how a system's internal dynamics, its own dynamics, are characterized here, okay? I'm going to skip through this except to say that a lot of these diagrams that we're going to be seeing are designed to help us broaden our mental models that guide our decisions. They help us think through the set of factors in their tangling that relates to the systems we're dealing with. And the reflection here on the health sphere is particularly keen, I think, given the long history of deleterious feedbacks, of sort of neglected side effects that came back and bite us, whether it's antibiotic resistance or those examples of cigarette nicotine attempts to lower it, or lower tar in cigarettes, or budget cuts that understaff STI clinics only to pay through the nose because of higher STI rates. So many times we shortchange ourselves because we have a very narrow view, right? Very narrow view of a situation. And we make decisions based on a narrow mental model, and we end up being bitten by some other feedback or, quote, side effect that we didn't anticipate. So these models that we're about to look at are designed to be broad. They are designed to be inclusive. They're designed to help us think through early on what factors are relevant, and then we will basically use a logical knife to cut away many features of them and when we go into a quantitative model. So system dynamics does aspire to sort of a broader way of conceptualizing the system. And the primary tool for doing this is a causal loop diagram. Okay? Causal loop diagrams focus on capturing causality, particularly feedback effects, and they do so in a way that you can teach to people very quickly, including people from all different backgrounds. They have actually a very clear, rigorous mathematical basis in terms of partial derivatives that I won't go into. But I'm going to help you understand these and help you understand how you can put them together. I will note that I have used causal diagrams with agent-based models to formulate thinking for an agent-based model, because after all, in agent-based models, as Elizabeth emphasized, we could capture feedbacks. They're just not in front of us as visible yet. We've got our project. But system dynamics causal loop diagrams can be very useful as a precursor to agent-based modeling as well. Now, within the context of causal loop diagrams, we have a diagram that consists of vertices and edges. Okay? It's a diagram which is not a DAG, it's not a directed acyclic graph, it's a full graph where we have vertices which represent concepts with a clear polarity. I emphasize that again. These concepts like hunger, food ingested, they need to be something with a clear polarity associated. There's a notion of what it means to have more of it or less of it, okay? And you want to be cautious about that, because sometimes we fall into the trap of putting something down in the area, but it lacks a clear polarity. We don't know what it means for it to go up or go down in value, get larger or smaller. And then there are links between these. And a link represents a posited, a sort of hypothesized causal relationship. Sometimes it's more firmly grounded in empirical evidence and knowledge perhaps from laboratory studies or clinical trials or what have you. In other cases, it is hypothesized. We posit as a working hypothesis that there's a link like this. And a link from A to B is associated with a polarity, either positive or negative, plus or minus. If it's ambiguous, you want to expand it into a set of causal pathways. We'll come to that. Suppose we have something from A to B, a link from A to B, here hunger to food ingested, that's associated with a positive polarity. What does that mean? Well, what it means is that if A, hunger, rises, then B, food ingested, will tend to rise. All other things being equal, if nothing else specifically is changing at the same time, if we're only changing A, it'll tend to lead B to be higher than the value it otherwise would have had. Okay? So we're not saying if hunger goes up, food ingested rises over time. We're just saying if we're hungry, we'll tend to eat more food than if we were not hungry, right? All other things being equal. We're not in a changed environment which limits our access to food, etc. So positive will mean, okay, increasing A will lead B to go in the same direction, all other things being equal compared to the value it would have had. So let's follow that through. So if hunger decreases, it'll tend to mean that my food ingested in the next little bit will tend to decrease, all other things being equal, when compared to the value it otherwise would have had I stayed hungry. Let me repeat that again. So we'll plus there, if hunger goes up, food ingested will tend to go up. I'll put it as a brief term, compared to the value it otherwise would have had. If hunger goes down, food ingested will tend to go down. Does that make sense? Okay, now let's think about a negative polarity. If we have an arrow from A to B, here, let's say A to C, right, or B to C, food ingested to hunger. If the source goes up, food ingested goes up, it'll tend to mean that hunger will go down compared to the value it otherwise would have had, although this would be equal. It'll change in the opposite direction. If food ingested goes down, hunger will tend to go up. Okay? Does that make sense? So a plus would indicate a causal relationship where the source rises, the destination will rise compared to the value it otherwise would have had. A negative link would indicate the source rises, and in response, causally, we posit that the destination will go down compared to the value it would have had. And if the source went down, the destination would go up compared to the value. It's the opposite direction. Some people like to write these with same. Instead of plus, they write S. And for a minus, they write O for opposite. So meaning like, does it change in the same direction or opposite direction? And there's a little tempest in a teapot around about that in system dynamics literature.
Do the arrows always go in this counterclockwise?
No. We'll draw them counterclockwise or clockwise. Late last night, while you were all in bed, I had visions of system dynamics dancing in my head, and fortunately there was no fire. But what there was I was musing on. Actually, I think this was 6 o'clock this morning or something. I was musing how I tend to draw arrows counterclockwise. Maybe that's because I'm a lefty. When my professors at MIT, some professors I worked with at MIT doing a modeling project, found out I was a lefty. They said, that explains everything. Kurt's a lefty too. Explains
nothing.
So no, it doesn't have to go counterclockwise, but we'll come to what this represents. So a few tips about reasoning about linked polarity. It's easy to get confused about linked polarity in context of a causal chain. A goes to B, and B's to C, and C to D. When you're thinking about assigning those polarities, it's best to focus on each link of that chain. Think about that link in isolation. So if we have, A going to B, and B to C here, if you want to assign them polarity, think about A and B and ask, if A were to go up, would B tend to go up compared to the value it otherwise would have had, or go down compared to the value it would have? And so assign a polarity for that, and then think about B to C. And say, if B were to go up, would it lead to C to rise or fall compared to the value it would have had? And assign a polarity to that. there'll be time enough for thinking about the full chain when the dealing's done. Okay, when it's when the whole thing is when the whole chain is put together. But think about each link in isolation. Kurt.
So if you look at the one you just drew on the left,
Yeah.
you had also a link directly from A to C.
Yeah.
Right.
If you also were to have a link from A to C,
if you
yeah.
also had a link from A to C,
Yeah.
then you would see in your data that when A goes up, C is going to change, not always up or down, because it's going to depend on the relative strength of the causal link from A to C and A to C through B.
Yeah.
Does that make sense? So when we're thinking about the polarity of those arrows, we have to think, what would happen, everything else being the same? Right? Like the rest of the models, the rest of the system stays unchanged, and A goes up.
That's right.
How is B impacted directly?
That's right.
Or C might be impacted through A, but it's also impacted through B. So we have to be able to pull those parts. And in fact, a lot of the times you have multiple causations between two things, and you're trying to sort of pull apart each cause that's important.
Multiple pathways. Yeah. Yeah. Yes.
So your source,
Yeah.
is it always, are you always thinking about it increasing?
No. It's just that. So no. I mean, A might fluctuate over time. Sometimes it goes up. Sometimes it goes down. For thinking about assigning the polarity, most people, because humans are known through psychological experiments, experimental psychology, be quite poor at reasoning about double negatives and so on. Most students, and I would put in there myself, tend to find it easier to figure out the polarity associated with a given link by thinking about that question: what if A were to increase? Would it lead to an increase or a decrease in B? But often I'll cross-check myself and ask if A were to decrease, yeah, would it lead to B to decrease, etc. And certainly assigning that plus, really you could think of it as meaning that they're changing in the same direction. So if A were to increase, B will tend to increase compared to the value it would have had. And the fact that you assign that plus, if it also implies, if A were to decrease, it implies that B were to decrease compared to the value it otherwise would have had. If you're in a situation where there's some asymmetry, if A goes up, B tends to go up, but not if A goes down, B doesn't tend to go down. There are more sophisticated ways you might capture that in a diagram, but most of the time you have this sort of situation where, they either change in the source and destination change in a common direction. When you change the source, it tends to lead to the destination changing in the same direction compared to the value it would have had, or they change in opposite directions. And yeah. Okay. Other questions? Yes?
What if you have either two things that would be directly associated, but there's like a threshold effect, or
Yep.
something else,
Yep.
another variable that has like a moderating impact?
Indeed. So there's several ways that we can depict something like this, and I have been known to engage in deliberate innovations around this. So, to show moderating effects, something like this. And with thresholds, you can have, a threshold that's expressed as part of this, and often that could be integrated fairly well as sort of a separate pathway. But the moderating effect, I have been known to do that. And that departs from sort of the most traditional form of causal loop diagrams, but I'm not one for worrying about if people are going to come get me for it. I think it's useful. If it's useful for you, if it communicates to the requisite stakeholders, go ahead. That's great. These are tools for thinking. They're tools for, and there's a problem if they're getting in the way of our thinking, right? And if there's a crisp relationship we believe is not captured in this current form, you might want to capture it through that. Often moderators by purists would be captured as sort of yet another factor that would be impacting it. So there's some moderator here, and we would posit that B's change would depend on the value of C as well as the value for A. And so if A increased depending on the value of C, it might yield no increase at all for some values of C, or it might lead some, and they would do it that way. But I personally think the incorporation of moderation as an explicit construct is a useful one, and I have been known to use it. But you have to understand, from the standpoint of both system dynamics and agent-based modeling, I'm a rogue actor. Well, let's put it this way: I don't spend a lot of time worrying about what other people think. I try to do what's good for the healthcare system and public health, and if I think it's useful, I use it. And if people want to criticize me, well, I have better things to do with my time than worry about it. I'm not someone to get up in arms about these things. Okay, so a few tips. Students often get thrown off by. Variables should be noun phrases. They're very commonly noun phrases. Variables should be directional. It should have a polarity associated with them. We can think of more and less, and therefore they should be at least ordinal. It becomes problematic if we have a variable that is simply a category. Men. Well, okay, I guess you could say there's more men or fewer men. But if you simply have a category there, it may not be clear what it means. And so, with system dynamics, really the method is well adapted for characterizing continuous or semi-continuous variables that are at least ordinal in character. And if you have something that's not, if you have a dichotomous thing, for example, you might have likelihood of addiction, for example. You could have strength of addiction, degree of addiction, right? But you might also have, likelihood of death or likelihood of dropout or something like that. That can be a probability of dropping out. Links should have unambiguous polarity. If there's a problem where you're running and it's not clear what the polarity is, almost always, almost invariably, it means you got to add more pathways. You're thinking there's actually different pathways to this. Sometimes it goes up, sometimes it goes down because of different causal pathways involved. And it almost always is dealt with by adding more pathways. It's been many years since I've been in a situation where it's not been resolved, that if it's ever occurred. This is kind of a injunction to my engineering students. People are part of the system. People are decision making in the system often, and even if you're involving, characterizing a healthcare system, be sure the people are in there. Engineers tend to view people as kind of outside their systems, which is one of the reasons that the problems come about. It was the human's fault. There was a human involved, They didn't enter the data right. The system was perfect. It was just they entered the data wrong. I don't exaggerate. So these diagrams can get big, and you want to be careful with them. There are hierarchical versions of them, but once again, we want to use purpose, like what are we trying to get out of this to limit the scope. We're not trying to exhaustively document all the causal pathways. We're trying to ask for the phenomena we're interested in, or for the difficulty we're grappling with, what are the major causal pathways that are germane, okay? It's a good practice to label loops, to give a short name for a loop as some sort of vicious cycle, or some sort of the poverty cycle or something like that. You can give pithy names, which are actually really helpful for parsing the diagram for someone to kind of say, oh, I know what that means. This is an important student injunction. This holds true for dynamic modeling. Some of you have even heard me make utterances to this effect in my circulations to your groups. Distinguish between perceived and actual situations. With dynamic modeling, we are positing underlying processes out there in the world, and then often people have perceptions of those processes which may be different than the underlying process. Often at the least they're delayed. They don't realize what the situation is until later, right? Sometimes their perception is off base from what's actually going on, particularly with latent factors. And generally, you will want to distinguish between perceived and actual situation in many contexts. And particularly if you're dealing with things like screening in your models, tests, outcomes, etc., you will want to make a real distinction between here. Often we incorporate targets for balancing loops, sort of the value that they're sort of tending toward. We'll see that in a little bit. Okay, so these diagrams we build up, they are called causal loop diagrams because they are often characterized by the presence of loops. Loops, situations where there is a path from A back through a set of other variables back to A. And this is indicative of a feedback. This is indicative of a situation where a change in one part of the system is posited to lead to a cascading series of subsequent changes and other factors that come back and either reinforce or push back again, work to damp out or balance the original change. And these phenomena are very familiar phenomena. So let's look at a few of these, right? This is one that I hope governs everyone in the room. More to the point, I hope it governs all of our health decision makers. Although I have limited confidence the degree to which the White House is currently engaged in participating in this loop. I think there's other loops. There's other loops that dominated the White House at the current
One might
juncture.
say endless loops.
Endless loops. That's right. Vicious cycles. So we make more mistakes. We make, hopefully, although often there's some delay involved, and we can indicate delays here. There's learning from those mistakes over time, and that helps us make fewer mistakes, or at least not be as subject to the same mistakes, right? This is a balancing loop. It's something where it kind of checks our tendency to make mistakes by hopefully allowing us to learn from them and to lessen our deviation. We do the same thing, right? If we're walking home reading a book or looking at our mail or looking at the latest news story, we occasionally look up and correct our position, right? Or we'll learn from our deviation and correct it, right? Familiar stuff. We see this, though, in organizational systems, right? We have an emergency department queue size, so you have a long time for. Okay, so I went curling one time and I fell on my elbow. You folks know what curling is? Yeah. Okay. So curling is a game I love. My grandparents were really big curlers, and I was on the ice one time and I slipped and I hurt my elbow and I thought I broke it. And I went and told my wife, who's an MD PhD, and I said, I think I'll go to the emergency room. She said, don't go to the emergency room. They're going to laugh at you. They're not going to take you seriously. And I said, well, I want to go. Maybe it's broken. I had images of having a gimp arm for a long time or what have you. And so I said, I'm going to go. And so I went there, and long story short, they triaged me and probably put me as CTAS 5 score, the Canadian triage acuity score, and probably said, okay, this guy, we don't need to see anytime soon. And people started to come in on stretchers from car accidents, and people came in with upper respiratory symptoms, distress, etc. And I was sitting there, and I left without being seen, right? Eventually I left. After about 3 hours, after my laptop battery died and I couldn't do any more modeling or what have you, I said, okay, maybe my elbow wasn't broken after all. And it wasn't broken. My wife came back and I told her just what I said. Yeah, that's true. So I learned from my mistakes. 2 loops operated there, right? So this is a familiar one. Things grow, and there's a self-regulatory nature of this process too. The queue gets too long, more people leave, and it lowers the queue. Do you have a feel for why that's a negative loop? We talk about loop classification. To figure out the classification of a loop, what we do at a technical level is we multiply the signs associated with that loop. So here we have a plus and a minus, and just like the rule of signs, two negatives multiply to be a positive and negative multiply to be a negative, two positives multiply to be a positive. You use the rule of signs there, positive times a negative is a negative. That's a negative feedback, but it makes sense. You think about it. So when we assign these loops, we think about each link in isolation. Say, if emergency department queue size went up, would that lead to the likelihood the patient leaves without being seen go up or down? And then we ask, likelihood the patient being seen goes up, does it lead to an increase or decrease in the queue size? So you think about each link in isolation. But it's very useful when reasoning about the loop polarity to think about the whole thing as a cascading series of changes. So the EDQ size goes up. There's more people in the queue. That will tend to increase the likelihood that a patient will balk, will leave, bug out of there, right? Much as I did. And that will tend to decrease the emergency. By them leaving, that will tend to decrease the emergency queue size, right? You think through the whole thing. Okay, how about this one? Perceived level of risk. That tends to increase my perception of risk. So perceived level of risk relates to, okay, what level of risk do I think it is? And then I compare it to sort of a level I find acceptable. And if I have more excess risk compared to what I'm comfortable with, it would tend to lead to measures to lessen the risk to myself through maybe for an infectious disease or environmentally acquired or person to person. I'll be more careful about my hygiene and my care and mixing, my social contacts or whatever. Think about flu going around, and that will tend to lessen my level of risk, and that will tend to lessen over time my perceived level of risk. Is the thought over time? Sort of my perception is okay. I'm probably less exposed to people now. So this is a negative feedback as well. It's a balancing loop.
Real quick, what are
Yeah.
the two dash lines?
That means a delay.
Oh, the way-
We posit a delay and generally put in that delay to indicate that like a given link is long in its time that it requires compared to other components of the system. So, sometimes, like let's think about a situation where you have grades in a class that only has a few assignments in it, and class in university, right? A student's mistakes and misunderstandings may take a while, if we only have a few assignments, it may take a while before they have the opportunity to learn from their mistakes. And so we might put a delay there. And that will reflect the fact that, we have some longer period of time.
Can I ask a
Yeah,
question about the
sure.
risk group?
Yeah,
So, in
yeah,
this,
yeah.
I know for this one, this is like one loop, but
Yeah.
would you, where it says like measures to lessen risk,
Yeah.
would that be in a place where you might build other?
That's absolutely right.
So like.
And we're going,
Oh, okay.
yeah, we're going there. Not in this particular example, but yes, we might have a set of other specific sort of structures that relate and that articulate with this. Among other things that limit our ability to do this, limit our ability to engage in prophylactic behavior or what have you. Yeah.
I have a question. So
Yeah.
this self-regulation process,
Yeah.
you assume that it will change over time.
That it's changing over time. Sorry.
That it won't change over time or change?
Oh, okay, so let me distinguish between two ways of understanding your question. You can help me alert me to which one you mean. One way to interpret is the variables here will change. The value of these variables will change over time is what's posited here. That's why we associate polarities. So if we have a larger number of mistakes posited, it'll lead to larger amount of learning from mistakes. We're positing some change over time in those variables. And in fact, as we'll see, and I could jump forward, it will have dynamic consequences in terms of behavior over time associated with the variables. But I suspect that what you may be asking about is are the structural relationships being captured here between things posited to be continuous, to be if not constant or fixed over time. The fact that we have links that are of a certain polarity, for example, and yes, by default, those polarities are posited to be long-standing. That one's unlikely to have a plus turn to a minus. But we do sometimes show with these diagrams cases where there's actually a change in the underlying system that will change, for example, the polarity from one to the other. And in fact, much of system dynamics is designed to use models to change, like how a manager of a system will respond to adverse outcomes. They might have a impulse to do it one way, but instead you teach them actually it's better to do this other way. And so they'll actually change their response to the system. And there are ways of illustrating that. Yes?
That example you just gave is a bit, it's really where you're changing it exogenously from the model. I mean, that's your experimental one condition, right?
That's right.
You change the polarity of the arrow and you see how that affects the rest of the system. So that might be a perceived leverage point in your system. But a lot of times you can get really interesting dynamic behavior happening without having to change the polarities of the arrows, because you're going to get multiple loops competing for interest over different times. So you might find in certain time regimes that you've got a certain set of reinforcing feedback loops that really take over, but then a certain value that's part of that loop might get impacted enough to cross the threshold or reach a point where another set of loops kind of end up being more dominant in that time regime, and then you observe different behavior, and all of these different behavior regimes are happening with a static set of arrows.
Right.
So most of the time, like I don't know if I've really ever seen a model that I'm working with, which is way less experienced than Nate, but most of the time, the arrows they're fixed.
Yeah, but you get very interesting dynamics. We'll see that in a minute. We'll see this issue of competing loops.
Yeah.
Okay, so another example of a negative feedback, right? Thumb sucking on the part of an infant to regulate their stress levels. We talk about this a lot, right? Self-regulatory behavior, for those who are familiar with aspects of the psychology literature involved, etc. Failure to self-regulate appropriately can be imputed in early offending and agonistic behavior, etc., between individuals. Now, we have feedbacks that are balancing, we've just been looking at, but we also have feedbacks that are reinforcing. Now, feedbacks that are balancing go by the name negative feedback. Why? Because a change at one part of the system, let's say an increase in infant distress, leads to a rippling set of cascading changes that ripple across and push back against. They act in the opposite direction, hence negative direction compared to the original one. If infant distress goes up, it leads to a ripple series of changes that lowers infant distress. If infant distress goes down, they're less likely to suck their thumb, and it doesn't push back against it to that degree. Okay, let's talk about vicious and virtuous cycles, though. These are cases where we have a reinforcing feedback, and we show that with a plus. This is a case where a change in the original factor, say occurrence of smoking, leads to a rippling set of cascading changes that amplify that original change. So Johnny's first couple cigarettes lead to a growing level of nicotine addiction, which furthers his propensity to smoke, further his intensity of smoking and his ongoing use of smoking. So there's a reinforcing feedback. And we talk about this informally, right? We talk about vicious cycles, right? A vicious cycle of poverty and substance abuse, for example. And what we're relating to is actually very much this. On the other hand, these reinforcing feedbacks are by no means always deleterious. They're by no means always adverse in their consequences. In social marketing, for example, where we're trying to put out messaging about healthy behaviors or what have you, often we're interested in a message going viral, right? A message that we get out there, having its visibility, lead to sharing of it on social media, sharing of links and so on, which leads to greater visibility. I do work with the American Legacy Foundation, used to be called American Legacy, now Truth Initiative, on anti-tobacco industry advertising, to counter tobacco industry advertising. This is what they hope for. They release these very, very well-produced music videos and so on that have anti-smoking themes, and they're looking for it being shared and going viral and people's likes and in a way that drives it further. They want to see that rapid growth, right? They want to see that growth. And similarly, we have other cases which are deleterious. An infant gets distressed, the caregiver distressed, maybe it's a mother dealing with postpartum depression, which furthers infant distress, etc. Now, when we're dealing with these systems, though, it's very rare that we deal with one feedback at a time. Generally, you have multiple feedbacks, and these feedbacks interact in ways that are quite non-obvious. So we might have infant self-regulation and caregiver self-regulation. Maybe the caregiver is involved in efforts to do yoga, meditation, exercise that will lower levels of distress. But there's still this sort of reinforcing feedback here that needs to be managed. And what happens is you get these regulatory ones competing with this reinforcing one, and it leads to dynamics to change over time that are quite different than if you had any one of these in isolation. So here, we are dealing with competing loops, competing feedbacks. Here with smoking, right? We'll have perhaps this inner loop of nicotine addiction, but smoking may, over time, hence the delay, lead to adverse health effects. Smokers' cough might develop in the first few years, but really serious emphysema and certainly lung cancers, heart disease might develop only over many decades. And over time, those adverse health effects might lead to a commitment to cessation, which might tend to lower the amount of smoking. I was thinking about adding an additional one here having to do with craving, but didn't have time to do that. And meanwhile, smoking leads to a sort of mixing among smokers, which leads to a social network, which is very rich in those having the same type of smoking behavior, and therefore tends to reinforce the tendency to smoking. So, if we think about feedback, ladies and gentlemen, we can have balancing feedbacks and reinforcing feedbacks. Balancing feedbacks lead to stability, and reinforcing feedbacks lead to rapid change. Think about a message going viral, social media messaging going viral from the Legacy Initiative. That's what social marketing wants. It's what companies want, right? They want to sell product. They want that latest version of the iPhone to sell like hotcakes, people to be talking about it, people to be buying it. They want this kind of log linear growth curve. And so it is with social marketing. And there's also cases where, in a positive direction, our immune system kicks in. It starts multiplying the cell complement to fight a certain new pathogen, and it marshals the evidence to snuff out that viral infection. Balancing loops like this tend to lead to balancing behavior, to cases where we have a system that comes to an equilibrium. So the fact that we have these kind of competing loops, these loops here, the fact that we highlight them is reflective of the fact that loops shape behavior in important ways, right? Same thing with, I get hungry, I eat, and it tends to bring my hunger back into balance. I get thirsty, I drink water, it tends to bring my thirst back into balance. My salt metabolism, my weight, etc. There's regulatory processes, some conscious, some physiologic, some organizational, some in terms of legal or regulatory, that bring our systems back into balance. Yeah? Brenda.
So I'm trying to sort of compare and contrast the things that we've heard about
Yep.
ABM so
Yep.
far and what we're hearing about
Yep.
systems dynamics. And so I feel like with ABMs we were pushed, especially in our small groups or in
Yeah.
my small group, to identify feedback loops, right?
Mhm. Yep.
And so we were drawing feedbacks. So I'm asking myself, so far with what you've talked about, is the defining difference between ABMs and systems dynamics the level that we're interested in? Like, are these loops sort of ubiquitous? Meaning like
Yeah.
they're
Physiologic, all the way up to organizational, societal.
right,
Yeah.
like versus like maybe the loops might be different within individuals in an ABM?
Yeah, but a lot of these are within individuals as
Okay.
well. The
So maybe I guess I should
Yeah.
ask, have we gotten to a point yet
Yeah.
where,
Yeah.
in your lecture, where ABMs and system dynamics kind of diverge?
Not, well, let's put it this way. This methodology came from system dynamics. The selection of feedbacks as a key focus, I think in system science for ABMs was shaped a lot by thinking from system dynamics of these as very useful, very important features of complex systems. It's what system dynamics focuses
Right.
on. It together with accumulation processes. Agent-based modeling can incorporate feedbacks, but it's been in the literature. If you go look at the ABM literature, feedbacks are far less central to that literature. What's very central, completely central in the ABM literature traditionally is things like agent-agent environment interactions and these rules for governing agents' evolution. But we did use feedbacks as kind of a foremost emphasis in that first exercise we went through, because we believe that many features of complex systems, not all, many hallmarks of those systems can be expressed as variants of feedback effects. Feedbacks are when, remember yesterday Matt talked about adaptive features of a system. The system changes in response to what's going on, the behavior of agents changes, and that you could view as a form of feedbacks. But in system dynamics, the feedbacks are front and center, they're in your face, and when you're creating these diagrams, they're in your face. And in ABM, they are often not brought out explicitly, but they're there behind the scenes. And often, in my view, I do agent-based modeling in a feedback-centric way too. It's not as obvious that they're central. So I would say that the focus on feedbacks in your groups is more reflection. They're important in complex systems, and they can be captured in either framework. But in system dynamics, they are front and center. They're like the main attraction, as it were. In agent-based modeling, you could look at an agent-based model for a while, interact with it, and you wouldn't necessarily be thinking as consciously for many models of the feedbacks traditionally. But in this class, we do emphasize it because we do believe that it's a useful cross-fertilization and it's very important for the system's evolution. Kurt, do you want to say something?
Yeah, just some of the things that he did talk about so far this morning that are different between agent-based and system dynamics is that agent-based is, I mean, he sort of touched on it, but agent-based system dynamics models can be built much more quickly. Like, they map more closely to a causal loop diagram than does an agent-based model. So if you've already got a causal loop diagram of your situation, translating that into a simulation model into system dynamics is going to be a much quicker process. Right? So that's one of the things he talked about that's a pretty significant difference. Because from the system dynamics perspective, and maybe he'll get into this, is you only really have to ask yourself for each of the parameters in your causal loop diagram, is it a stock, is it a flow, maybe is it a parameter. But with an agent-based model, you have to ask, is it a property, is it an action, is it a rule?
Is it captured in networks? Is it captured in geographic context, etc.?
That adds a complexity in translating that into your model.
Yeah.
The second thing that he talked about that is sort of more the focus within a system dynamics architecture is that these parameters and these variables are often thought in the abstract. You know, maybe the loops that he's got, that this perceived level of risk This is sort of something that's explicitly capturing an abstract concept. But these are all things that have to be pretty much continuous or ordinal in state, whereas agent-based model doesn't really focus on the limits of what a property can be.
Yeah, and often in agent-based models, it depends a little bit on the package that you use and so on, but often we have things characterized using state charts, for example, that are categorical in nature. And we'll have constructs like networks in geographic context that don't really fit neatly into the causal loop diagram. And we'll often have, within an agent-based framework, an interest in capturing causality at multiple levels of scale. So, within a person, between people, within a school, within a neighborhood, within a region. And we might think about actually there being some, not only different aggregation summaries, but some dynamics of the school environment and how it regulates itself, or of a city, right? In city planning and outlays for green space, etc. There's processes that operate at those different levels, and that is something that we are working with this separate language, which is a variant of causal diagram. It builds on that, but that's just a piece. Causal diagrams are just a piece of it for agent-based modeling, because we don't find it as direct a translation. But I still build agent-based causal diagrams informally for agent-based models. It's just they don't sometimes quite capture all the set of factors I want to think about for an agent-based model. Okay. So when we have a negative feedback, ladies and gentlemen, that has a delay associated with it, what we tend to see is a situation the system tries to get into equilibrium, but it's not nearly as neat as this, where it approaches, it's disturbed and then it bounces back. Think about yourself going out on a wintry Saskatchewan day, and you start getting cold, but your system revs up. Your metabolism revs up while you play that game of hockey against Kurt.
Might be a bit hard for them to be able to imagine.
So moving right along, so their system might get right into balance, back into balance after some time with your metabolism revving up. You get hungry, you go eat something. For a lot of systems which have long delays, what happens is there's a cycle. And we see this in many contexts, right? You see it with weight loss. You have weight cycling associated with. You see it associated with sort of making mistakes. You see it associated with management of certain clinical conditions, sort of management of anemia. It's been very well documented in sort of red blood cell populations. You see it with organizations, sort of this overshoot and undershoot. You see it with driving, right? You folks may never have driven on an icy road. Packed snow. Yeah. Wow. Whole areas of life unexplored. But what happens is like as your car slides, if it's really icy, and Saskatchewan tends to be less icy because it just gets cold, and it tends not to freeze and sort of melt as much as Eastern Canada. But basically you can get the car sort of oversteering, and you understeer. You sort of end up overshooting, and the car can fishtail for a while, and it's very much like that And as our perception, we went too far, we got to turn back. You can also get growth and plateau phenomena. This is with two feedbacks like this interacting. So one feedback that's a positive feedback leads to very rapid change, like transmission of infection. Another feedback that's it's depleting the number of individuals who can still be infected. TB is lifelong infection. So here, as people get infected with TB, you might see in a community a rapid rise. But then over time, the number of susceptible individuals is depleted, and what you see is it going up to sort of some plateau level. You might also get this for social media with sharing of social marketing messages where there's some unreached group. So the number of people that you've reached over time rises quickly early on, but then you deplete the people who haven't heard about it yet. And so you get this kind of phenomenon here. the point is that each of these types of systems has an archetype, that each of these archetypes, as they're called in system dynamics, has a behavior associated with it. And an experienced system dynamics modeler can take a look at a larger diagram and basically, a diagram like this, and basically see quite a bit of dynamic opportunities of interest. They can kind of get a sense, about some of the phenomenon that you might expect from a system like this, but without being able to quantitatively say exactly what the outcome will be for the following. Okay, so we're running a little bit behind. Normally I'd have students undertake an exercise now, and I would invite you over the break, if you'd like to try something like this, we can give some feedback. But create a causal diagram. I'd like to suggest something about sort of links between poverty and substance abuse, things that trap people in poverty related to substance abuse. Think vicious cycle, right? What things might there be linking these two that lead to feedback effects? Or an issue of your choosing. It turns out that these causal diagrams, when they're built properly, they can be incredibly insightful, and they can be insightful for people for all sorts of backgrounds. But what students often find is that your first couple attempts are not nearly as crisp as you'd like. And there's a kind of education that goes on to making really good diagrams like this, making them clear, less ambiguous, well laid out, not overwhelming, etc. So I'd like to invite you. I think we'll take a break now, and I appreciate your persistence. We will, after the break, go into hands-on modeling with the next stage, which is called stocks and flows. And we'll actually see how stocks and flows take what we build up with the causal diagram to the next stage. They sharpen it, they make it more specific, and they make it precise enough to simulate. Okay? Thank you very much. And I'll go post this. And make sure your AnyLogics are up.